New information from the Centers for Disease Control and Prevention on the uptick of respiratory viruses and treatment options today. In a call with reporters, the agency is encouraging people to wear masks to prevent and help reduce the spread of illnesses this season as COVID, flu, and RSV circulate at the same time. Now, the CDC is also considering expanding its system of COVID community levels just to take into account other respiratory viruses. Now, the system informs the CDC when to advise the public to wear masks. Dr. Nick Yagoda, Chief Medical Officer for Community Care Health Centers, is joining us today. Thank you so much for being with us, Doctor.
My pleasure. Thanks for having me.
Okay, so parents are overwhelmed. We've received several calls from viewers. Many Texans are dealing with severe illness. And a new report even shows that flu hospitalizations here in the U.S. haven't been this high this early in the season in over a decade. So paint a picture. What are you all seeing in our local hospitals?
So as you said, we're seeing a huge spike in respiratory illness cases this year, far above what we've seen in the last decade. I'll talk about the three illnesses that are driving this trend. The first is RSV, as you mentioned, which is respiratory syncytial virus. This saw a big spike at the beginning of November, though gratefully we're now starting to see a slow down trend of those cases. The second is flu, which continues to grow very rapidly in our region. At this point, 1 out of every 4 people who get a test is coming up positive, which is an extraordinarily high level. And lastly, COVID is starting to show signs of a resurgence. While the number of cases and hospitalizations remains relatively low, the number of people testing positive when they get a test is increasing pretty rapidly. All of this has resulted in a triple epidemic in our region, hitting our kids especially hard. Even so, our pediatric emergency rooms have been overwhelmed with respiratory illness cases, which have been really crowding out true emergencies. In response, community care and others have increased our pediatric capacity. And I encourage those with and without insurance to come make an appointment with us for those services that don't require emergency care.
Okay, and let's talk let's talk about testing. What are the testing options for these viruses? And then what's the best intervention, the treatment intervention, if you do test positive?
So great question. There are home tests for COVID. Though those can be expensive. Our primary care services, as well as many other in the region, including Austin Public Health, have access to free testing for our community members. And so I encourage anyone who has symptoms or has some concern about a high-risk exposure to get testing at your primary care physician's office.
Okay, and I know you don't have a crystal ball, so we can't really predict the future, but what's the outlook? What are we thinking about heading into the holidays as it relates to these viruses?
So we should continue to expect an increase in flu and COVID. We hope that RSV is really quieting down for the rest of the season. What I would encourage is that everyone gets their annual flu shot. These reduce severity, they reduce hospitalizations, and the new bivalent COVID vaccines also reduce severity, reduce hospitalizations, and even long COVID. That said, only 15% of eligible people age 5 and above have yet gotten this updated vaccine. We're still combating a lot of misinformation about these overwhelmingly safe vaccines, and it's probably a lack of trust as the central problem. So it's important for us in healthcare as well as in public health to build a vibrant and trustworthy relationship with our communities. The second action is really for folks who are symptomatic to mask up. If you're experiencing symptoms, please mask and get a test as we talked about. And lastly, if you or a loved one is sick, consider the best place of care. Many of these illnesses can be managed at a primary care physician like community care.
Okay, doctor, and a lot of our coworkers here, some of them said that they have even gotten, the flu twice or COVID. Are you seeing that among your patients, and what should people know about that?
So most importantly, reinfections do occur for people who have been vaccinated, for people who have had the infection in the past. That does occur. It doesn't mean that your immune system isn't working. It doesn't mean that the vaccines aren't working. The vaccines are really designed to reduce severe disease, to reduce hospitalizations and death, and they're doing a tremendous job at that. So while we can do our best to prevent infections like masking and testing to ensure that you're not carrying the virus, really understanding that illness is a part of our everyday life, and that the most important thing is to make sure you're vaccinated so that you can decrease your risk for severe disease.
All right, Dr. Yagoda, thanks so much for the insight, and thank you so much for the information you provided us.
Appreciate it. Thank you.